My name is Julie Horton. I'm a physical therapist at Big Blue Canopy Therapy in Blue Ash, Ohio. I've been a physical therapist for over 18 years. I've had the opportunity to work all over the country in a variety of settings with both adults and pediatrics. Most of that time I've specialized in pediatrics, and I'm a board certified specialist in pediatric physical therapy. One of the things that I've worked with the most as a pediatric physical therapist is a condition called torticollis. Torticollis is a condition in a baby's neck where a neck muscle is tighter than it should be. This is something that we might see soon after a baby is born due to positioning in utero. This is more common in a mother who's pregnant with multiples, or perhaps a baby that's really big for the mother's size, and other reasons as well. The other thing that can happen is sometimes during the birth process, as the baby's coming out, they may catch their shoulder or have a little bit of an injury on their neck, and that can sometimes also lead to neck tightness as well. Another type of torticollis can be acquired. So this happens after the baby is born, and it is something that we're seeing more and more often, especially since they started implementing the Back to Sleep program in the 1990s. Torticollis typically involves the sternocleidomastoid muscle, or the SCM muscle. That muscle attaches back here and comes across the front onto your collarbone. The muscle pulls your head into side bending one direction and rotation the opposite direction. While that muscle is typically involved, there are several other muscles in the neck that may also be involved, or that SCM muscle may not be involved at all, and you may see tightness primarily in another muscle group. Some of the other muscles that are involved in torticollis are the upper traps, levator scapula, scalenes, and the suboccipitals. Often with torticollis, we see tightness in some of the muscles, while on the opposite side, we see weakness in those muscles. So while the baby may be stronger on their tighter side, they're weaker on the opposite side. One of the early signs of torticollis is that the baby may have a preference turning their head towards one direction. As a baby develops head control and strength, they should be able to freely move their head from one side to the other. Another sign of torticollis is when a baby has a preference for tipping their head to one side. So when they are positioned in a supported sitting position, such as in a high chair or in their car seat, you may find that they tip their head towards one side more than the other. Since the muscle typically involved in torticollis is the SCM muscle, the rotation preference and the side bending preference are opposite of each other. So what you may see is that if your right SCM muscle is involved, the baby may prefer to turn their head to the left, but then tip their head to the right. One of the things we recommend if you are noticing that your baby has a preference to turn their head to one direction is to try to bring their attention towards the opposite side. You can do this by bringing toys over to that side. You can stand to that side and talk to the baby to see if they'll turn their head towards your voice. Or you can position them in such a way when you're holding them or when you place them in the crib at night so that something of interest is to the opposite side of where they prefer. Another thing I recommend to help with a child that you suspect may have torticollis or to prevent acquired torticollis is to encourage supervised tummy time while the baby is awake. Tummy time is a very important position for babies to spend time in. As I mentioned earlier, that we saw an increase in the cases of torticollis after they implemented the Back to Sleep program. The Back to Sleep program is a very important program, and that is something that we should continue working with, is always putting the baby back to sleep on their backs. However, we want to encourage families to get as much tummy time as possible when the baby is awake and supervised. Tummy time is a very important position for all babies, and it's an important basis for all of their development. There are lots of tips and tricks to encourage tummy time, and we have some of those resources available on the Big Blue Canopy website. One of the things we see frequently with torticollis is plagiocephaly. Plagiocephaly is head flattening on the posterior lateral portion of the skull where the baby's head stays primarily because they prefer to turn their head to one side. We also may see flattening on just the back spot, and that's referred to as brachycephaly. When you come in for an evaluation, a physical therapist will talk to you about your baby. We'll find out information about your pregnancy history and the birth history, and to find out what you've noticed at home since the baby's been home. This might include preferences for feeding, preferences for being held a certain direction, and preferences for sleep. As part of the evaluation, the physical therapist will assess your baby's neck. They will look at their range of motion, their strength, and they will look at their overall positioning when they're on their backs, when they're on their bellies, and when they're sitting, whether it's supported or independent. The physical therapist will also look to see how your baby's working towards reaching their milestones. Often we see in torticollis that a baby may have delayed milestones, or they may be reaching milestones asymmetrically. So they may have a preference for rolling one direction, or they may have a preference for holding their body towards one side when in sitting. Also, as part of the evaluation, the physical therapist will assess your baby's head shape. If they have concerns about their head shape, they may also take measurements using calipers. The APTA Clinical Practice Guideline provides us with a classification system to help us to determine how severe your baby's torticollis is. This is a grading system that goes from grade 1 to grade 8. At the end of your evaluation, your physical therapist will provide you with an individualized home exercise program that is tailored towards your baby's needs. They will also make a recommendation for treatment and talk about follow-up. If you have questions about your baby's neck or their head shape, we recommend that you talk to your pediatrician or reach out to us at Big Blue Canopy.